So the next myth buster is once your skin starts sagging, then surgery is the only option. So this is not true. Certainly in the early stages of aging, when you start to see that the skin is potentially becoming a little bit looser or starting to develop jowling and things like that, certainly you can do a lot to the skin that doesn't involve the knife. So first and foremost, no matter what else you're going to consider, whether it is surgery or some procedures, you need to have basic skincare right, because your collagen is unfortunately being lost by a rate of about 1.5% per year from your mid to late 20s onwards, and then particularly for women around the time of menopause, up to 30% in those 5 years around after menopause. So it's really important that you try and stimulate that collagen essentially from an early age, from your mid 20s onwards, by using sunscreen every single day, hail, rain or shine, basically to stop the collagen from being broken down by the UV damage, and also to introduce a topical retinoid at this age, so that you're also trying to stimulate collagen to keep everything lifted and tightened. So they're your two most important skincare that is required to also maintain the benefit of any procedure that you do. Then, of course, if you're trying to avoid the knife and you're only starting to see the first signs of sagging, you can do lots of procedures, including filler to replace volume loss, radio frequency microneedling, standard microneedling, lasers. There are loads of different procedures, also polynucleotides, which is another type of injectable, and these can be used in multiple body sites, including around the eye area, the entire face, neck, décolletage. So you can use it to treat that entire area. So of course there is more that you can do. It doesn't always result in going straight to surgery, but of course, if somebody has done nothing, has not used any sunscreen for their lifetime, has never used a retinoid, and is potentially in their 60s and 70s and sees significant sagging, or for example they may have lost weight quite quickly, then this can make this more obvious. Then certainly if there's a lot of excessive skin or loose skin essentially, and a lot of sagging, particularly in the lower face and neck, then the best benefit that you're going to get is of course undergoing a deep plane facelift and neck lift. But for anyone who's considering just starting into that journey to either prevent the early signs of aging or seize the early signs of aging, of course there are lots of things you can do that don't involve the knife.